I'm Sana Khan and you're watching Medicircle. Today we have with us Naama Pozniak. She is a founder and CEO at A+InsuranceService. She is also a proactive healthcare insurance strategic innovator, virtual mindful and stress initiative speaker, and a meditation coach. Please welcome her to our show, Rendezvous on Universal Health Coverage Series. Hi Naama, how are you?
Hi, namaste. How are you? How you doing?
Namaste, we're fine too. Okay, so to begin with, what according to you are the challenges and opportunities for advancing universal health coverage in a world coping with COVID-19?
So this is a great question because, I think that the pandemic has actually allowed us to quickening everything that has to do with healthcare. That's the first thing. Second, allowed us and is still allowing us to bring all the minds together, the science, the scientists, the sages, the leaders, the politician, the healthcare industry. Everyone comes together to actually create a sustainable healthcare. So the conversation is now on the table. We looking at a global mindset in order to overcome the new now. And I don't like when the people say it's the new normal. Nothing is normal about the new now. It's what we're living right now. Are we going to think that it's going to be bad? Or are we going to make a lemonade out of these lemons? So what we're seeing right now is actually a huge opportunity for the world to come together, merge healthcare system. And when I say merge healthcare system, I've been traveling to India for the last 10 years, and I've been practicing the Eastern medicine. And I think what's happening here in the United States is that we became such a westernized society that we are practicing the Western medicine, which is actually treat disease and not taking care of people, mind, body, spirit as a connection. Right. So I do believe that when this opportunity, global opportunity to to change the mindset, to allow us to treat people in focus on prevention, education about prevention is huge. And part of what I love about the Eastern medicine, that it's teaching you and reminding you basically, because we all know what we need to do, but it's a good reminder to take care of yourself. And if anything, this pandemic really taught us to take care of ourselves. Self-care is mainly a conversation, especially in the United States, I'm sure everywhere in the world, but how are we going to come together and allow a system that will sustain the future of health? And that's, I think, important, and we see massive pressure, on the healthcare system right now. And we have to have a strategy. So we have to come together. It's a best opportunity today to come together and radically embrace, AI and security and this, a development of platforms and telemedicine, and be smart about our healthcare. So I think that intuition and being collaborating between countries and between the healthcare system all over the world to see actually what's working and communicating, it's a key.
True, very true, very well said. Further, Naama, with developing technology and research, we are now able to do a lot of things which were impossible earlier. However, there is a gap in the pursuit of equity in access to quality health services for all in terms of financial approach. What are your suggestions to overcome them?
This is crucial, because if anything, the pandemic was teaching us a big lesson that, we have to pay attention to the diversity and inclusion, basically. You know, I mean, we have to make sure we take care of the people that cannot afford healthcare. Access to healthcare, and you know, we see a higher rate of death among, you know, I mean, the population that don't have access to care. And I think as a society, this is a wake-up call. And if we need to listen to this wake-up call and make sure that we are taking care of each other. So the fact that you have so many people that have access to the best healthcare in the world, the education, the ability now to get the vaccine, even, you know, I mean, it's going to be now really very interesting to see. Not that I am a big fan of the vaccine, but I'm just saying it's already been a discussion everywhere in the world, who is getting the vaccine first, who is getting access to it. But we need to really, in order for us to sustain ourselves, in order for us to look into a future of a real health, a real happiness, because I mean, it's all connected. We have to operate from love. We have to make sure we love and embrace the communities that needs our help. We need to have more resource. We have to have more, the technology will be, and I already see it, that technology will help these population to evolve and to learn and to have access. But how are you taking care of people that don't have a smartphone? You know, how are you taking care of people that have no access to water? You know, I mean, that's basic. And I think that, again, I grew up in Israel, and in our communities, I mean, that's how we operate. We give every year, we give 1/10 of what we make, and it doesn't matter how much you make. You give it. It's called tikkun olam. So you give, and I really calling everyone in the world to make sure we are communicating, coming together, and sharing resources, because the fact that we're going to have, and this pandemic will make it worse, I think, because, you know, the people, even people that had a status and access, oh, you know, I'm seeing it because we are insuring a lot of people. We are taking care of so many people, healthcare and health insurance policies. So I'm seeing how people cannot afford it anymore. And the system in the United States is not sustainable. You know, I mean, we do need to, of course, to have a private system, you know, and to merge into something that will have, you know, make sense. But unless we're going to take care of the people who really needs healthcare, we as people, I don't think we can thrive or survive. So I believe our intention should be for these communities that are unfortunate and have no access to care, and we should start with so much love and care. And, you know, I mean, I don't have to tell you, because you guys are the best. Although when I travel all over the world, you know, and I meet Indians and Eastern people from the East, you know, I need to remind them that, you know, just taking an extra breath a day, spending time in quiet space, in meditation, practicing yoga, eating well, you know, I mean, eating food is such a medicine, and we need to start using this sources, you know, and resources for to take care of ourselves. So it's really the practice of medicine that needs to change. And I think that we are right now, I actually feel like we are in the right way to take care of the population that really need attention socially, economically, and access to care is number one. And we as people, you know, I mean, as leaders, we have to take care of these people. It's just heartbreaking to see. And the pandemic, if anything, brought the importance of the health, I mean, the discussion of health. And it's so obvious that, we have to take care of somebody else in order to be feeling good as well.
Right. We all need to change the way of living now. It's high time.
Yeah. Yeah.
Okay.
For a meaningful, if we want to have a meaningful global healthcare, two things must be happening, or maybe three, but definitely two, is we have to merge the Eastern and Western medicine. We have to learn, we have to teach the world, how can you heal yourself? How can you learn how to breathe, to spend time in quiet space, to have a meaningful connection, and that it's not always about the how much money you have, or what do you have in the bank, or what type of car you're driving, or do you know what I mean? This must be changed.
Okay, so COVID crisis bringing in the cash crisis. Do you think we will be witnessing investments in promising health tech startups providing affordable care?
So if anything, the pandemic brought a very new situation, and healthcare became essential. It's not a choice. It's not a luxury. It's not I mean, it's not something that we can say, oh, we can, do we want it, or we don't.
Right.
So what I'm seeing, and I'm also part of what I do, I lead meditation with many conferences all over the world. So I'm participating in a lot of the events, and from the security to the AI to the health insurance globally to any to the spiritual world, I mean, any type of conference that you can imagine right now, because the access is really, it became easier to access information also and learning. AI will be really, I think, should radically change the healthcare industry. We're seeing more startups, we're seeing more innovation is happening every day. The physician of the future will actually see patients in a very virtual way. And when we are continuing working remotely, everything is enhancing in a way that telemedicine is just became a key, which was telemedicine it's been around for 10 years, but people didn't want to use it. So now the pandemic is actually bringing us all together to enhance and allow, especially the AI and it's unbelievable what I'm seeing now in technology. The technology allowed us to connect and to exchange information in a way that we can learn what is, for example, there is a rare case in India or in China or anywhere in the world, in Europe, and then we can learn about it in the United States while we are in the operation room. So I've seen technology in every possible aspect of health, women health, women over 40, for example, the conversation about the needs of what each population needs is very, very crucial. So we're seeing more devices becoming available. We're seeing definitely a massive use of the smartphones, and I think that the future of health will be in our hands, in our phone. And also prevention is a way when we collaborate together with the AI and technology and all these companies that come up with such an amazing solutions for the future of healthcare. I think it will be a key, and really we will have to embrace it. It's just really important. So and I think that again, we need to use technology to allow us to learn, to help us. I've seen huge amount of people are now downloading all kinds of apps that, you know, help them to keep themselves healthy, which can be sometimes very simple. It doesn't have to be a whole big deal, but again, you need to have access to it, and for a meaningful healthcare, global healthcare, we really need to embrace technology and allow these companies and you know, private sector to invest in the future of health. It's key. It's a key. And I never seen so many companies and new technologies, and it also has to do with the security, because, you know, privacy is a key also for a patient life. And I think that they are now working on the security and merging all the possible information to allow us to enhance healthcare. Yeah. So, you know, we all in this together. It's one thing that the pandemic were teaching us, that we have to change. We can't continue doing the same thing over and over and expect the change to happen. We really need to care about each other and allow healing to embrace. And we have to remember that meditation and yoga are maybe, you know, slow medicine, but are very effective. And we need to learn how to heal ourselves, be happy, and take care of the people around us, because our future depends on, you know, on how much we will support and give and share and take care of the people, the unfortunate people, and to each other in the world, you know. I mean, it's just, yeah, very important.
Thank you so much, Naama, for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Yeah, thank you so much, and good luck to you guys. Stay safe.
Stay safe.
Send my love to Ma India. Namaste, guys. Namaste.
Namaste. Have a good day.
You too.